out, the operator guides the sternum down.
So this hand's a big hand now because I'm going to be directing his sternum with one hand. I could put Tessa one hand on top of another hand, but I'm going to be directing it with this hand. This is my treatment hand right now. So on air in, Jen, thank you very much. You've been very helpful. On air in, I'm going to take his sternum and his manubrium, and I'm going to take that sternum and I'm going to move it down towards his pocket. Remember yesterday? Down towards his pocket, Susan. On air out. I said air in, I meant air in. Air out. Air out. Down towards his pocket. Air in. Hope I got that right. What's that? Tip. Tip's going to go down towards the pocket. Okay. Air in, I'm going to be helping him pull the air in, not with his neck, with his diaphragm, by maintaining the previous position for exhalation. So my new right hand that was under his body to get the air in is now my left hand that's guiding it in with a muscle that goes off that undersurface of that carapace called the diaphragm. So I'm directing the diaphragm leaflet on the left side to move air in through the lungs, more so on the right side. And I could do the very same thing on the right side if I wanted to, for the left airflow. On air in, I'm guiding it with my left hand. On air out, my left hand is taking those ribs that are externally rotated on the left side, and I'm internally rotating those ribs with the very same hand that I used for inhalation phase of respiration. So my left hand is my inhalation hand and my exhalation hand. My right hand could be under his neck, could be on top of the left hand, or could even be on the shoulder, just resting. It's kind of up to you. For him, he has really no neck issues, so I'm not going to put it under his neck. If he had a reduced cervical spine, Tessa, I would reduced lordosis in his spine, I'd put it under his neck. If he had a thorax that was bunched up like this, I'd put it under his right, I put it on his right arm. Since he's a good-looking guy, I'd put my hand right on top of it. And we'd call that the sternal technique. Now remember, he's locked up. This guy's under some stress right now. He can't internally rotate his right arm. Makes sense, Jonathan? Mm-hmm. He's only breathing efficiently with one diaphragm. So now I'm going to take my towel, I'm going to put it on his sternum, and I'll do the sternal technique. It's kind of warm, you okay?
Perfect.
Okay, my middle finger is on his notch. I'm going to the left of the sternum. Do you feel that, Jonathan? Mm-hmm. My hand is a little bit slightly tilted towards his left pocket. And finger 3, 4, and 5 are moving down, down. So he takes a breath of air in. I want to stop a minute. This is the most powerful technique in your manual. Have a little moment. Come to Jesus moment right there. This is a powerful technique. This controls neurology. It controls your attitude. It's your chest. This bone is your chest bone. And if you went across the pond and you spent some time in Asia and some European countries, and you talk to people who really understand the importance of this godlike bone, this Allah bone, the sternum, we would not be going over it this fast. It's a sacred bone. It generates activity, and it generates rest spiritually to some of these people. This is a major bone. So I'm going to go very careful with it. I'm guiding it, and I'm not trying to get spiritual on you. I'm just trying to tell you other cultures. But yet I'm getting spiritual with you. I have to pull away Because if you don't respect this bone, I could have very easily, Heather, I can make him a BC bilateral, and I will just because I like him. Right off the bat, by doing this technique wrong. So I'm going to put my hand on him, Brianna. He had full IR in his left side. Full IR a minute ago. Full IR. And I'm going to do this wrong. I thought I knew the technique. I didn't study the technique. I watched him do it. I've got a pretty important person in front of me. I think I should do the sternal technique because I'm small, they're big, whatever reason. And you do this. You take your hand, you put it on the breastbone, and you have no respect for it. And you start leaning on it. And you take a breath of air in. And you didn't let it expand. And he blew out the air. And you're doing CPR compression. And he took another breath in. Did you hear it? He just went into a bilateral brachial chain. It took one breath, Heather, to make him a belly breather. One breath, Jonathan. And now I've got a problem. I have limited internal rotation on both hands. Limited horizontal abduction on both sides. Limited adduction drop test on both sides. Would you agree? I'm not pushing any harder than I did on the other side. Mm-mm. I can show you he's limited horizontal abduction if you'd like to see it. One breath. Because you know what? I went over the course too fast. As an instructor, I'd say, Heather, please just don't pound these sternums. Please don't put your hand on there and just do CPR. He doesn't need CPR. He needs guidance. He needs these ribs to do what? And these ribs to close down. Use your verbiage. It'll work. I'm just trying to help you understand that. So don't just do the sternal technique because it looks easier. If you pick the sternal technique, you picked a highly sensitive technique. You can't screw up on this technique. You can kind of screw up on the first technique. But you can't screw up on this technique. Because the results you're going to get is saying, I knew that PRI stuff was too good to be true. I did the same thing he wanted me to do, and I got more mileage out of this, but now I'm going to the sternal technique, which he told me was easier to do. But in reality, Heather, as easy as it is, it's the biggest way to screw somebody up. Because now you just kicked in all the razors of the neck. SCM just got pretty kind of cranky. Scalene's got pretty cranky. And if you have the respect for them like I do, Tessa, after 40 years, 35 years of practice, trust me, I would not do that. Yes?
Is there like certain patient populations that you should do this with?
This particular technique you could do with every single person, including a mother who's in their last stages of carrying a baby, right before. You can do this activity with every single person, even cancer patients, anybody, if you're what? If you're what, everybody? Careful and sensitive. And you're following the sternum. All I'm going to do is guide the sternum. Who's going to treat this man right now with the sternal technique? Say it loud, Jonathan. Me. Jonathan, who's going to treat you?
Me.
Correct. Who messed you up, Jonathan?
You.
No. Jonathan, you messed yourself up, buddy. I'm sorry. All I did was hold you, my friend. I was just loving you a little bit. Okay? But do you understand who's treating the guy? He is. All I'm going to do is I'm just going to use what it's needed. The minimum amount of what? The minimum amount of resistance and guidance is all he needs. If I start to overpower him, who's going to fight me? And when he gets overpowering that in his mind, there's some wolves coming after him. What system's going to kick in? Sympathetics, and he's done. He's pulling in air. He's done. So here I go. All I'm going to do is take my hand, and we're going to take these two arms that did not internally rotate or horizontally adduct. And we're going to see how he does, okay? And now I can breathe a little easier and show you the technique. Because you're not going to see a lot of activity here. The only person that's going to feel this activity is who? This guy. And he'll tell you what he feels, if he's nice. Takes a breath of air in. Blows out the air. And he's going to pause. He's going to breathe in. And he's going to blow. He's going to pause. 2, 3, 4. He's going to breathe in. And he's going to blow out the air. Oh. What's that called, everybody? What was that called? Jonathan, you can talk to me now. You're fine, buddy. What's this called, Jonathan?
What's this called?
What's this called right here? What position are you in? He has maximized his zone of apposition. He has a ZOA. Did you hear it? Did you feel it?
Yeah.
It just went into... So what's this called? Watch my hand. Watch. Breathe in. Chest just rose. Belly rose. Blow out. Down it went. Watch it again, Heather. Up. Blow out. Down it went. Up. Blow out. Down it went. He's getting more air out than he's getting in. That's not hyperinflation. That's hypoinflation for him. So I know parasympathetically he's there. I know he has full IR. I would bet the farm on it. I know he's got IR over here. There's no way he can't have IR over here. I know he has full horizontal abduction on the side. Come on over here because he just told me. You saw it. He had more exhalation than what, everybody? Inhalation. Whoa, hello everybody. Can you see me over there? Jonathan, who did that?
Me?
Thank you. We got one more test to do and we'll let you guys go for lunch. Did that make sense? That technique is neuro. That's a sensory technique. That's a huge technique. I would practice it on your loved ones before you practice it on your dog. I don't care who you practice it on. Don't just run into a room and start doing compressions. The left hand comes down. In the DVD, I really go over this slow. Left hand, left finger's got to come down. They stay down. Air goes. Jonathan, isn't that what it felt like? Is that what it felt like?
Yeah.
The left side was staying down, correct? Did you feel that?
Yes, it was. Yes.
And then when you say, I got to breathe in, what's he doing? I never let up on that left side, did I?
No.
So most of the tension you felt from my hand was coming on that left lower border, was it not?
Yes.
And then what did I do with this palm? What did you have to do with this chamber right here? You had to find that palm, right? He had to find this right anterior mediastinum, just like he was feeling for the first time his left posterior mediastinum from what? The sheet. Because if this was going forward, we know that back was going back. Isn't that cool? I took his right rib hump away. I put it right back here. Remember those men and women showing those pictures of that concavity? You see that? I just brought it up. I said, can you feel that palm? If you do this technique and you don't have your palm there, it's not going to work. Can you feel that palm? Can you feel that arch? Can you feel it? Can you sense that palm right there? Can you feel that palm? If you can't feel that palm, you don't have a posterior mediastinum on the left side. Rick, did that make sense? It's got to come right there. I could say, Rick, I could come up here and I could say, Jonathan, that is my fingers. I was on the judicial committee for a few years in the APTA, and I don't want any sexual misconduct from anybody. But touching lightly is not going to make him feel better, or her. So I could have said, do you feel my finger right here, ma'am? And she's going to go, what the heck are you doing? But seriously, if you can get that out of your head, and you say, okay, no sexual misconduct. Do you feel my finger right here, Rick? Yeah, I feel it. Breathe in. Do you feel it? Now, blow out. It went away. Find it. Come on. Oh, good. Do you feel it again? Same thing. It's the same thing. Did that help everybody? Did I explain to you, Tyler, that you can actually sense where your rib